Hi, this is Dr. Nick. I'm the incrementalist here with incremental insights for better business and better health.
And I'm Fred Goldstein with Accountable Health, here helping employers look at their overall health improvement programs and how do you keep a healthy population of employees. So one of the fascinating issues that's been going on, the NBA obviously put a lot of money, resources, thought, and time into trying to keep themselves open and did it. I understand you're a big NBA fan, maybe a team or two out there you're thinking of. Is it something you follow, Nick?
So sorry, folks, it's just not my sport. Although I have watched it occasionally. The closest I got to the NBA was hanging out with Shaq O'Neal, believe it or not, years ago, when we were in a hotel in LA with some terminally ill kids that we'd brought to the US, and their team showed up in the hotel. We were carrying all this luggage, and the thing that really struck me was the fact that these guys picked up not 2 suitcases, but 4. This was before the wheelie days. They put one under each arm and they were just delightful people. We didn't even know who they were and just wondered why they were really tall. So sorry, but no. But I love the data that they produced. And here's what's really interesting. They created a bubble. They did it successfully. But more importantly, what did they do? They did daily testing and they tracked and followed and captured all of that data. Now, they had 65 positive cases in their cohort. I don't know what the denominator is off the top of my head, but whatever that number was from daily testing. Of those 65, interesting that the B117 variant, which, let's be clear, originated in a finding. So the first time it was identified was the UK. That doesn't make it a UK variant. I just think it's important to make that point. It is the B117 variant. And they found 7 of them in their population. And they tracked them over time. So they have this enormous wealth of data, not only testing them daily, but also tracking their symptoms, how they progress, the viral load, all of those things. And there were some really useful and interesting insights. And this is the beauty of the NBA and all the fantastic stuff that I love watching and following of them. And that's the science that we get out of this sport. And, you know, what did they discover? Well, first of all, with those individuals that had the B117 variant, they had a longer illness. In fact, it was averaging over 13 days, where those that didn't have the B117 were about 8 days. Now, the peak viral concentration occurred later in the B117. So it was a longer ramp up, which goes some way to explaining why this is more infective. You've got a longer period of time that you're infective. You don't develop symptoms as early. So you're essentially out without being tested if we're not doing daily testing and knowing everybody's status all the time. So that introduces essentially an increased opportunity for infectivity. And the other thing that showed up was that the viral load was not quite as high. Now, bear in mind, this is early data. It's a small number, but it was a pretty well-studied group. Not as high. So that puts to bed or suggests that this idea that the reason it was more infective was because there was more virus to be found. That's probably not the case. It's this extended. But here's the kicker, Fred, and you and I both know this because we talk to institutions, educational facilities, and this is one of the things that we keep on saying. You need to keep on top of this because the information is changing. If that disease is extending for 13 days, that means that the isolation for those people that tested positive, especially if you had B117, needs to be longer, because if you're getting out at 10 days and you're still infected, you're potentially spreading. So we're going to have to rethink some of that.
That's just fascinating. And I'm waiting to see the day, because obviously the NBA is all about statistics, that they put up there on the screen as I'm watching my favorite team, the Boston Celtics, on what's going on, what the variants are. It's fantastic that you've dug into that study, Nick, because it really is some unique stuff.
You mean they don't do that? I didn't know they didn't do that.
And
can I give you one other thing that
sure.
we've all got to thank the NBA for? Those of you that are cursing the nasopharyngeal swabbing, especially the elephant long device that's used, the validation of the spit protocol came from the MBA process. It was them that studied that and showed that it was valid. So we can all thank them for not having our noses scraped all of the time.
Absolutely, a fantastic bit of work there. And I really appreciate that you always find these unique things, dive into them, highly relevant. Everyone's talking variants. What does it mean? How does it spread? And this is some really good data that we can use. It also points to the whole thing. Look, the NBA was able to create an ultimate bubble, tighter than most groups could do, but it worked. Even though they had B117 in there,
Right.
it worked.
Yeah.
And that's important.
So what about you, Fred? What have you been looking at?
So one of the things I find interesting for employers to consider is what do you do now around disabilities? We do have this group of long COVID folks, long haulers, but long COVID's a much better term obviously to use, and it's really difficult and sad. They're seeing a lot of different symptoms impacting people for a considerable amount of time. They don't know if ultimately it's 3%, it's 5%, but given the number of people in the United States who have been infected, it's going to be a substantial number of individuals who are potentially working for companies that may need to file for disability. And so now there really isn't clear guidance yet on whether or not it qualifies. And we're going to have to watch this, and employers are going to have to watch this over time to say, wow, is my disability insurance going to have to be adjusted because I've had a number of individuals that are struggling with this and now are not able to function? And you're seeing a number of employers consider that and hear from their employees, and they've said, look, this person can't come back to work, whether it's brain fog, you know, some of the issues around respiration, being able to breathe well enough to be able to function. All of these will impact work. So we're going to have to watch what the Social Security Administration does with this. A number of members of Congress are looking to asking the Social Security Administration to study the specific issue because we're still learning. This needs more data, just like the NBA is supplying, and maybe we'll begin to see that come out of some of the workforce as well. So something for employers to keep up with.
I think what's interesting there to me is that it's not just the individual challenge here. This is an employer challenge that thinks about that disability insurance. Are you covered based on that? These are questions that need to be answered because obviously this is now a new prevalent disease. It's pandemic. It will move to some subversion of that at some point and will continue to affect. And, you know, clearly we have to take account of this, and we don't know, but we really need to be sure that we're supporting our population so that they can essentially recover from this. It seems like there's this very long tail for some folks. I've seen it personally with some friends of mine. It takes a long time, and you know, you want them to be covered.
Absolutely. So as employers think about this, if you have questions about your benefits package, your insurance, how to operate within the current COVID pandemic, open, et cetera, or even look more broadly at your employee health needs and costs for your insurance, et cetera, please reach out to us at valighhealth.com and we'll be happy to answer any questions you have. So thanks so much. This is Fred Goldstein with Accountable Health, and we really appreciate you joining us this week.
Hi, and this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better NBA, and better health.